Hey guys, it's been a little bit long since I made a video of myself. I am continuing to make videos here and there, not as consistently as I want to, for another channel all about my cats and my dogs and my partridge in a pear tree. There's one kitty right there walking around. That's one of my many. So my other channel, which again, not that consistent posting these videos, but I am trying to get a little bit more consistent. You can find me on YouTube at Animal Talk 1515. Animal Talk 1515. I actually didn't make up that handle. YouTube did that for me, and I was going to change it, but we'll leave it like that for now. I want to make this video real quick because I want to post something about these hernias. Yes, you guessed it, 2 hernias. Can't believe there's 2. Not a double hernia, although it is a double hernia. Let me explain. I think if you go online and you look up double hernia, I think it basically means you have 2 hernias in the same areas, like basically 2 inguinal, 2 femoral, like that. Like something bilateral. This is a inguinal hernia that I've had now literally since 2014. We'll go back to details on that in a second. And a hernia that developed, I'm going to say a few years ago, in the midline. I don't know what they call that, but it was sore in that area, and then it developed a lump. Didn't think it was a hernia, but it's a hernia. So, guys, the inguinal hernia that I have, actually, I was told, and I don't know if I put this in my prior videos about this. I think I only made 2 videos about this, and it's quite a while now. If you go back, you'll see it's probably like, I think the last one could have been 2-3 years ago. The time is flying by. But anyway, I was told it was inguinal, and then I went to my mom's doctor just to go to an appointment for her for something entirely different. And my mom had this doctor do an ultrasound in his office on me, and he said it was a femoral hernia. I think the reason why the doctors are saying 2 different things is because it's literally in the midline between inguinal and femoral. If you know anatomy, or if you don't know anatomy, you can still go on YouTube and look up, or Google, the difference between femoral and inguinal hernias. And literally, it's like a line of demarcation in your groin. So I think you could have a hernia right in the midline, like literally between the 2. And then I don't know what the doctors call it. It's both. Probably if they were to go in there and do surgery, they would then be able to tell me afterwards if it was inguinal, femoral, or literally in the midline. There's Bunny. You guys can hear more about Bunny on my other channel with my other horde of cats. So many cats. So many cats. So little money, so little time. It's exhausting. Have I brought it on myself? Possibly. Am I spaying and neutering? Yes. Were other neighbors feeding them before? Yes. Am I feeding them myself now? Yes. Am I exhausted? Yes. We'll get into that on my other channel. Right, Bunny? Yeah, that's a whole nother subject for a whole nother channel and a whole nother day. Here's this one over here. Come here, Bunny. Bunny. I don't want to flip the camera around because then I'm going to waste a bunch of time. Anyway, so let me just tell you guys this. In the beginning, when I first noticed that I possibly had a hernia, it wasn't even diagnosed. The reason it wasn't diagnosed, and everybody that's seen my other video will know this, but if you haven't, it's okay. I'll repeat it here. I had a bunch of soreness in my groin area. There was no visible lump or bulge. It was just sore. It felt like a sore muscle, like if you were to do too many leg lifts, or you stretched in the wrong way, or you were running or walking too fast and you pulled your groin muscle. That's what it felt like. But here's the weird part, you guys. At the time when I got this, I wasn't even working out. I was like a workout fanatic for like my whole life. I danced ballet starting at age 6. I stopped dancing at age 19 from fibromyalgia. Then I got into going to the gym and swimming, and I was just constantly active, never had a hernia. I'm now 55. Can't believe it. But time is flying by like crazy, way too fast. I'll be 56 in July. Time is just flying. I wish it wasn't. Makes me sad. Time is just going so too fast for me. And I think the older you get, the faster it goes. My mom says the same. There's Bunny. Want to see all my junk? Bunny. Bunny, Bunny. Say it. Show everybody your pretty face. You'll hear the story about why I call her Bunny in the other video. So anyway, I didn't have any visible lump, bulge, nothing there. And I went to the doctor a few times. It was sore for probably a year or two before I even mentioned it to the doctor. Probably at least a year, because I go once a year to the doctor. And finally, I get there, and he's like, he didn't see anything, but he ordered an ultrasound. I think I got, in the course of 1 year's time, maybe it was a couple months, probably a couple months, I got an ultrasound and a CT and an MRI. I was so thankful to this doctor. He's an amazing doctor. I didn't even beg him for those tests, but he decided to get them. And again, in my other video, you wouldn't believe what I went through, because I also went to gynecology, because I had to go for my PAP anyway. And the gynecologist at the time, now the doctor that ordered all those scans is my gynecologist, but I had a different gynecologist at the time. And she said that I had swollen lymph nodes in my groin. Now, I want you guys to hear this. This is super important. She wanted me to get the lymph nodes taken out for them to look at them for, I guess, possible cancer cells. I don't know. But she wanted me to, she wanted those to be screened for cancer. Forgot what they call that. Can't believe I'm blanking out right now. Okay, I changed positions, and guess what? You guys, I'm literally blanking out. I'm not going to stop the video because I suck at editing. I don't know how to put two videos together. I really don't. I wish that people would teach me how to edit. If anyone is watching this and you guys have an awesome, easy editing tool for me to use, please let me know. Because that way I could have stopped the video, and then I could have looked up the word that I'm thinking of, and then I could have pieced the videos back together. I can't believe I can't think of it. Anyway, it's what they do when they extract cells from anywhere in your body. Oh, I've just remembered, you guys, a biopsy. Can I edit this together? No. Biopsy. So anyway, she wanted those lymph nodes to be biopsied. When I heard the word biopsy, of course, I flipped. This is like going back 6 years ago or something. Because I'm thinking, you don't get a biopsy unless they think there's cancer, right? So they biopsied it. Needless to say, so I went under local anesthesia for them to extract lymph nodes from my groin, which of course I was numb because it was local anesthesia. When I got up from there and everything wore off, I was in so much pain, you guys. And my entire, think about this, from my groin down to my knee, the entire quadriceps area, the groin, oh my God, it looked like it was bruised for 2 weeks. It looked like someone had beat the living crap out of my leg. Like it looked like someone just beat me to a pulp. My entire leg was black and blue and purple and then yellow, and you know how the colors the bruises go through, for 2 weeks, and it was so sore. Anyway, needless to say, they found nothing, no cancer cells, thank God. Okay, but the biopsy, the funny part is, I don't know if I mentioned this in my other videos, the doctor that did the biopsy, originally the doctor that was called to do the biopsy didn't want to do the biopsy. He's like, those lymph nodes are movable. They don't need to be biopsied. You don't have cancer. But the gynecologist got mad at him and said, listen, I want a biopsy on this woman for sure. And so when she got that strict about it, of course I was scared, because I'm like, why is she so wanting to do this biopsy? Like, what is she? I was thinking, like, why would I have cancer in my groin? It's so weird. And everything was telling me that this was a hernia. But yet, the doctors were telling me I didn't have a hernia. Well, needless to say, I think that biopsy was done, I can't remember. I got to go back and look at my, all my charts and everything. I don't know whether she biopsied before or after I had my ultrasound, CT, and MRI of my groin. Like, maybe it was around the same time, because even though, here's the weird part. So I had all those tests, right? It said I had a hernia, but still on the physical exam, they couldn't see a hernia. The hernia would, I guess it was coming out a little bit when they would examine me, but it wasn't like bulging out, right? So what it is, and I did not know this again till years later, I had what is called, I guess, an invisible hernia. Oh, it sounds so medical, right? The term invisible hernia. Or hidden hernia. I guess you can look. I never really looked that up. I think I did. Look up hidden hernia. It's probably there. So all that means, I don't know if men get them, but I know women do. And basically the hernia is more, it's inside. So it means that even though it's not pushing out, right? You don't see it yet on the outside, but you still have a hernia because you have torn tissue inside your body. So that's what I had. It was torn inside. And finally, when they saw it all on the scans, they believed me. I mean, so many years of this. I was so sore, and I had this pain that told me there was a hernia, but it wasn't showing on the scans. I was living with it fine because guess what? I had gotten lazy. I wasn't going to the gym anymore, wasn't doing anything physical. So, but if I was like still into working out and I was into running or swimming or weightlifting, I would have wanted to get surgery on that right away. And I probably should have. Tell you why. The longer I went without doing anything, the worse it got. I now have a huge bulge in my groin. Yes, guys, I have a bulge in my groin, and I'm a female. No penis there, no scrotum. Huge bulge in my groin. So now, and it kind of, I wish I could show you, but I don't really know how to show you guys that. I can't really show you. It's in the groin area. I wish there was a way to do it. I did take pictures of it, but I just don't know if I should post them because they're a little risque. You know what I mean? But there's a bulge that is in the midline of my groin. And it is kind of dropped a little bit lower. So now I can understand why the doctor said it was femoral, because it's like pushing down into my leg. It's not on the thigh. It's in the midline of my groin. Like if you were to draw a line on your groin, it's basically a little bit lower than that line. So maybe it was inguinal and then dropped into the femoral canal. There's an area called the femoral canal. I don't know how it really progressed, but I'm telling you, now it hurts. I was going a long time without doing anything, and I had talked to my GP doctor about it, and he said, you know, people they can live their whole lives with a hernia. Like if you can handle it, no big deal. But you know, he said, you'll know when it's time to get surgery because it'll start really bothering you. So guess what? It's really bothering me. So now here's the problem, guys, on a personal note. I live with fibromyalgia, a sleep disorder. I've got basically a disability without getting disability. I just applied for disability because I can't function with the pain. I can't, not just the hernia, I'm talking overall body pain. Because I have fibromyalgia. I have what I believe undiagnosed Ehlers-Danlos Hypermobility Disorder. You guys can look that up. I think I brought that up in another video, and there's many videos online about Ehlers-Danlos. It is spelled EHLERS -Danlos, DANLOS, hypermobility syndrome. There's many forms of Ehlers-Danlos people can get. Hypermobility is the one that people can live a long life with. It's not really life-threatening, but it does affect your daily living. It causes chronic pain in your muscles and joints and tissues. It is a collagen disorder, or I should say lack of collagen disorder. And guess what, guys? I was never diagnosed with it, but I'm ready for this. People with Ehlers-Danlos hypermobility disorder get spontaneous hernias. So I think more and more and more, all the signs that I have this Ehlers-Danlos are pointing to the fact that I have Ehlers-Danlos. It's undiagnosed because I've lived with this for so long, and also fibromyalgia is a symptom of Ehlers-Danlos. Basically, fibromyalgia just means pain in your soft tissues. That's all that means. So Ehlers-Danlos is the disease named after two people that basically, I don't really know. I guess they discovered it. I have to look at who these people are, Ehlers-Danlos. I think it's two people with the name Ehlers-Danlos, with those two names. But anyway, the more I go through the symptoms of what Ehlers-Danlos is, the more I realize I have this. I've had pretty much every symptom of it. And it just wasn't diagnosed. But now that I'm getting all these spontaneous hernias, it's a huge clue that that's probably what I have. The reason why I never went and did genetic testing for Ehlers-Danlos is because I'm like, well, there's really no treatment for it. Once you get diagnosed, there's no treatment. There's bracing. You can use lots of braces. definitely would probably help to get collagen and take these supplements religiously because they do strengthen your tissues. I think it's important to do that. The supplements, the nutrition. I have read, by the way, you guys can look this up. I remember this woman. I haven't been following her lately, but you can find her on Facebook. She may be on YouTube. I haven't checked. Look up Heather Dane. Heather Dane, Dane. I think it's spelled. Yeah. She's a nutritionist who cured her own self of Ehlers-Danlos with collagen. She's very, very big on bone broth and all kinds of nutrition that increases your collagen in your body. And look, even if you couldn't heal your own Ehlers-Danlos with collagen, I mean, it's going to be good for your body to take collagen. It's great for you in every respect. It's great for your digestion. It's great for your tissues, your joints, your hair, your nails, everything. So, why not take it? It's good for you. You don't necessarily have to do just bone broth. There's all kinds of new collagen drinks and things out there too. Anyway, check out Heather Dane if you're interested in healing Ehlers-Danlos. If you want to learn more about nutrition, if you want to learn more about, collagen and taking it for your body for body pain, she's all about that. But I haven't checked her out in a while. But you can find her on Facebook and you can look for her on YouTube, which I'm going to do after I finish this video. So anyway, the bottom line, guys, is that I now have these 2 hernias, and I was going to tell you that because I'm not working because of my disabilities, I applied for disability. Don't know if I'm even going to receive it. I may not. They may turn me down. But I cannot afford health insurance because I don't work. So I'm in Miami, and we have a public hospital here called Jackson Hospital. And for the past about 5 years, I've had what's called a Jackson card. If you cannot afford insurance, they offer something called a Jackson card, but you do have to prove all of your income. You got to go through a whole thing where they have access to looking at your bank account. They look at your expenses. They look at the way you live. And then they grant you a card if you pass all these little, things that you have to submit, bills, things like that. It's like a whole thing. Anyway, I had this card for 5 years, and every year I would have to resubmit all my information. But ever since COVID, the date of resubmitting all my information changed. So they didn't tell me my card was expiring. It expired like 2 months ago, and I didn't even know. So now I'm in the process of having to resubmit all the crap, and it's exhausting and tiring and frustrating. And I mean, I got to, take pictures of all my bills. I got to take pictures of my bank account. I got to submit this, submit that. I live with my parents, so now most things are under their name. So if there's a cable bill, I have to submit it if it's in their name. If there's whatever bills, electricity. So I have to go to a notary, get that all signed up. It's like a whole... it's going to take hours. It's so exhausting and it's overwhelming for me. Some people can do all that stuff lickety-split, no problem. For me, with also undiagnosed attention deficit disorder, I can't focus, so I have a really hard time. Anything that deals with paperwork or organizing, I suck at it. So I'm putting it off, and I need to get it done because guess what else? I had a mammogram about 4 months ago, and something came out not great. I don't know what it is. I'm scared. That's another situation you guys have to tune in for. They called me back to do a diagnostic mammogram and an ultrasound. So I'm a little nervous about that. I am going to be telling my doctor that I really want to get a breast MRI too, because if you guys haven't heard about the breast assessment risk disorder, or did I say it wrong? Breast risk assessment disorder sheet, something like that. Put those words together. And then you will do this risk assessment. You can do it online yourself, or you can do it with your doctor. That is how you find what your risk assessment is to getting breast cancer. It's super important, you guys. Please Google it. It's something I haven't even done yet. I just found out about it 3 days ago. And this was what determined cancer in a celebrity whose name is going through my brain. I can't think of her name, guys. It was all over the internet. It was all over the news. She had a double mastectomy because of this risk assessment. They found out that she was very high risk for getting breast cancer. And guess what? She had cancer. And guess what else? Her breast cancer was not seen in a mammogram. It was not seen in an ultrasound. It was only seen in a breast MRI. And then they did the risk assessment and they decided that's it, double mastectomy. You guys, I can't believe I can't think of her name. Olivia Munn, is it? I think it's Olivia Munn. I might be wrong, but check it out, okay? And then you'll learn about the breast risk assessment test to do online. Tune in to hear more about what's going to happen with my hernia, what's going to happen with my Jackson card, what's going to happen with my ultrasound, what's going to happen with my breasts, what's going to happen with my groin. Hey, you guys get to know about my groin and my breasts. More than most people know. So that's it. Lots of tests. I'm really worried. I really would like to get a full body MRI. There's a lot going on in this body of mine, and I've been having chest pain too. So I don't think the chest pain has anything to do with my heart. I'm worried it has to do with the breast situation. I don't really know, but tune in. And maybe you guys can stay on top of me to get my Jackson card stuff finished, because it needs to be done before I can see the doctors. That's the problem. I need to get it done. It's basically my insurance. It has to be done. So you guys have a great day. Tune in. Do your risk assessment. Get your mammograms. Get your PAPs. Get your groins checked. I mean, literally, get it all checked out. Because if you have cancer, at least it'll be at a very, very, very little stage of cancer that can be treated. If you wait, like I'm waiting, which isn't good, anything's possible. Anything bad can happen. We don't want that to happen. We want you to be free of cancer. So get all these tests done, and please don't be afraid. If you've never had a PAP, it takes 2 seconds, guys. If you've never had a mammogram, get it done. It takes 5 minutes. You can do it. You can do it. And watch this. Get your tests done. I don't want to hear that anyone had cancer because they didn't have a PAP or a breast exam or any exam that prevents cancer. Oh my God, I forgot to tell you also. I have to get a colonoscopy and an endoscopy. You guys, basically my whole body has to be scanned. It's like, why can't we just do a full body MRI? Like, okay, the colon needs testing, the boobs need testing, the groin needs testing. Everything needs testing. So get it all done. You get it done too. And stick with me on the testing. Let's all do it together. Should be fun, right? Have a good day.